Why your child has cavities despite regular brushing. Being a parent is one of the hardest jobs anyone could ever have, and it isn't made any easier by the often complex and multifaceted concerns parents have to maintain for their child's health. One of the biggest areas of concern that doesn't get enough time in the press is your child's oral hygiene and how important it is for their immediate and long-term health. After all, the habits established early on often have a lasting and guiding impact on a child's life. One of the most challenging things you will ever face as a parent with a young child is getting them to understand how important it is to brush regularly and to take care of their teeth. But even if you have succeeded in this task, your child still might have oral complications such as cavities. That's why we're going to explain why cavities occur even if you brush regularly and do all the right things, as well as what you can do about it. But do remember, as a problem with many contributing factors, cavities could have one or more causes, so don't hone in on any one thing at the expense of the bigger picture. Probably the most common reason for cavities despite your child's regular brushing habit is because your child is not brushing her teeth properly. This means getting the teeth at the back of the mouth brushed as well as behind the teeth. Not only that, but they also need to floss regularly. It is recommended that adults help children with brushing their teeth until all of their adult teeth have come through. Again, the importance here is in establishing good, thorough oral hygiene habits that will last a lifetime. But you also want to prevent cavities in the here and now. Trust us, one of the first things any dentist will do if you face this problem is to show you and your child how to properly brush her teeth to prevent cavities. The second biggest contributing factor in the development of cavities is that your child is eating too often and maybe foods with too much sugar. You want to keep your brushings timed with your eating schedule, and this is hard to do if a child's eating schedule is haphazard. Try to stick to a set schedule for meals and limit the intake of sugary foods and drinks. This should give your child a marked improvement in her oral health and help you prevent cavities. And again, you are helping to guide your child towards optimal health habits now that she can practice for the rest of her life. Of course, the single best source for health practices where your child's teeth are concerned is her pediatric dentist. The dentist can help you identify issues, recommend solutions to the problem, and help you keep your child's oral health the best it can be. Regular checkups and cleanings are absolutely indispensable in this regard, and if you haven't already, then these checkups are something your child should have set up.